May I come in? Hi, Miss Jane Doe?
Yep.
Hi, I'm John Williams. I'm a PA student. I understand you're here for your breast exam, pap smear, and pelvic exam. All right, before we get started, I'm just going to wash my hands real quick. And can you just tell me your name, date of birth?
Jane Doe 6694.
Okay. And then I'll check your hospital number. Then we'll get started. All right, check name, date of birth, hospital. All right. Now first for breast exam, I'm going to have the patient just sitting upright, disrobed to the waist. And I would just have them sitting upright, and I inspect the breast, see if there's any dimpling, if there's any nipple discharge, any redness, rashes, retraction of the nipple, swelling, just any sort of inflammation. And then I'd have the patient, and I'd note the symmetry and if there's any deformities. Then I'd have the patient just lie supine for me, and for starting breast exam, I would maintain the other breast just draped on this side, just so one breast is shown to make it more comfortable and more privacy for the patient. I'd start the breast exam by examining I'm going to be going in small concentric circles in a vertical pattern around the breast, and I'm going to start at the axilla, just feel if there's any enlarged lymph nodes, starting at the axilla, and I'd use small, medium, or light, medium, and deep pressure, just going in. Just going down from the axilla, making sure there's no enlarged lymph nodes at the axilla, going all the way down to the bra line, and then go medially, and then back up in vertical overlapping strips, back up, all the way up to the clavicle, and I'd feel for infraclavicular lymph nodes and supraclavicular lymph nodes if there's any enlargement, and then come back down again in vertical overlapping strips and all the way to the nipple, and then down all the way to the bra line, and then come medially again, and then back up to the clavicle, small, medium, light pressure using the finger pads of my second, third, fourth finger, and then back down, and then all the way to the mid sternum. And then at the end, I would palpate the nipple, noting elasticity, if there's any discharge, nipple discharge, any drainage. And then I cover her up, and I perform the same exam on the left breast as well. So now I will prepare the patient for the pelvic exam. So I'd have the patient empty her bladder, and then I'd have the patient just lie supine with her head and shoulders on the pillow and her arms at her side, and I pull out the stirrups, have her put her heels in the stirrups, and so she'll just be lying supine. I'd have her draped from mid-abdomen to the knees. And once I get started, I depress the drape just so I can make eye contact. And for this exam, I'll be sitting down, but first I want to make sure to glove. And we'll start by just examining the external genitalia for the pelvic exam. So she'd be draped from mid-abdomen to the knees, and I'm just going to be open this, and I depress it, make sure I can maintain eye contact, and I just examine externally the perineum, the labia, and mons pubis, and then I'd separate the labia, look at the clitoris, the introitus, and the urethral meatus, And then I can move on to the speculum, insertion of the speculum. So I just warn the patient, and before I examine external genitalia, I should warn the patient as well. Just that I'll be looking and make sure, maybe touch her thigh, just make sure she knows my position. And now for moving on to insertion of the speculum, I've warned the patient that I'll be inserting the speculum. But make sure that it's closed, in a closed position. And I will insert my finger, have downward pressure with my index finger right here. And I'd insert the speculum. I'm going to go about like negative 45 degrees with it closed, and just go in slowly and carefully. Once I insert the speculum, I can remove my finger, and then I will just move it down to the horizontal position. And I'll make sure not to open it prematurely. And then I can open it up, and the cervix should cup the cervix, and then I can lock it into place, and I turn on the light, make sure it's in the correct position, make sure not open it prematurely to not pinch her vaginal mucosa, and the cervix should fall into place. I'd have the light on it, and I can reposition if needed. But now, I'll move on to obtaining a pap smear, so I'm just going to set my light source there. So to obtain the pap smear, I would get my cervical brush, and I'm going to do clockwise, just 360 degrees inside on the cervix, getting the squamous and columnar epithelial cells. So I'm going to insert it here, be careful, and do twist it 360 degrees, and make sure that when I remove it, be careful and put it in the preservative. Make sure not contaminated. So I'd put it in preservative here, and then just throw away the cervical brush, and then send off the culture to be examined. And then now for removal of the speculum. As I remove it, I'm also going to be observing the internal vagina, just a mucosa. Make sure if there's any discharge, any masses, ulcers, discolorations, redness, inflammation. But now I'm going to unlock it, but I'm going to maintain my thumb to keep it open, and I'm going to just slowly remove it, make sure not close it prematurely because I could pinch the vaginal mucosa. And just as I remove it, I'm just going to look at vaginal walls, and as it emerges, I can close the speculum. And just be careful as I remove it. And I'll place this here. So now for I'll be doing the bimanual exam, and for this exam I'll be standing. For that exam I would be sitting. So now I could put on different gloves and lubricate my fingers. Let's see. Let's lubricate my fingers here. So for this exam, I'm going to have my thumb abducted, and then cup my ring finger and my pinky, just have them flexed. So I'm just going to insert my two fingers into the vagina. Let's see here, and just separate the labia as I insert it. I'm going to feel for the cervix, note the shape, mobility, if there's any tenderness. Normally, there shouldn't be any tenderness when you move the cervix. And I'm going to note its position, and if there's any adnexal tenderness or any tenderness moving the cervix, then that can be indicative of pelvic inflammatory disease. I'm also going to just feel around for the fornices around the cervix and the uterus. And now I'm going to press my abdominal hand, or I'm going to have press my abdominal hand down, and I'm going to cup the cervix and elevate the cervix and the uterus up, and then just press down with or in between the umbilicus and the pubic symphysis, and just try to grasp the uterus with my hands, and then just press down. And now for feeling of the ovary, I'm going to have my fingers in the right lateral fornix, and then press down in the right lower quadrant, and just feel for ovary. Normally, ovary is going to be somewhat tender, although a cervix shouldn't be tender when you move it, but an ovary, it is fine for it to be a little tender. And just any adnexal tenderness can arise from salpingitis to ovarian abscess or ectopic pregnancy. And now I would just feel for the right ovary, and then I'd do the same thing on the left side for palpating the ovary. And now for moving on to the rectovaginal exam, I'd reapply different gloves, and I'm going to be inserting my index finger into the vagina, and then my middle finger into the anus. I'm going to warn the patient that she might feel like she has to make a valve movement, but it's completely normal and that she won't. And I'm going to have her bear down for me. So I'm just going to apply pressure in the anterior and lateral walls. And then now I'm going to just insert my index finger, and I can change gloves now to not prevent contamination. But I'm going to insert my finger into the rectal vault, feel for just if there's any masses. And after that, I would give the patient some tissues to wipe down her genitalia and anus. And that concludes the rectovaginal exam. And I'd have the patient, I would leave the room and just have the patient dress, and I'd come back and tell her that we're going to discuss our findings. But thank you for coming in today, Ms. Doe. I'll be back after you redress.